I'm thrilled to have a guest today who can share a perspective I haven't heard before. Most of the people I've talked to have only taken prednisone for a short period of time, but she's taken it for 20 years. And not only that, but she's had a side effect that people need to know about that should never happen in somebody as young as she. So welcome, Cristina, the Arthritis Dietitian. Welcome to the show.
Well, thank you, Dr. Megan, for having me. It's a pleasure to be here.
Awesome. So I am really excited to hear how you ended up on prednisone, what you're taking it for, and just how you got to this point. So let's start with just like, what did you take prednisone for the first time?
Well, the first time was 20 years ago, exactly, when I was experiencing, when I was diagnosed with rheumatoid arthritis. That's back home in Colombia. There were no biologics, there were no advanced treatments. The only treatments were prednisone, methotrexate, maybe plaquenil. So prednisone was the first thing that I was given.
And so you got some relief at that point from the rheumatoid arthritis, and like, where was it affecting you?
I believe so. I started a fairly high dose. At that time, it started me on like 50 milligrams for pain to reduce inflammation, and I believe it helped. But my rheumatoid arthritis was actually moderate to severe, and to the point that within the first 6 months of diagnosis, I developed joint deformities.
In 6 months?
Mm-hmm.
Oh my goodness. Wow. That is serious. That's severe right there for sure. Oh, wow. So it was helping. And then what? What happened next? Tell us more about your story.
They say that it was helping. They at that time, so honestly, my memory is a little blurry now at 20 years. But all I can remember is that they kept on adding medications, but never stopped the prednisone. I did receive advice that we cannot stop the prednisone right away. You're going to feel like severe side effects, and it's helping you with the inflammation. And the reality is that the moment I started to decrease the dosage of prednisone, my fingers started to swell up again. I started with more fatigue and more pain. So the doctors will automatically say, you know what, you still need the prednisone to support the other medication. So when I came to Canada, I was hoping that maybe getting more advanced treatments, they will be able to reduce or get rid of my prednisone dose, and it didn't happen. It's still the same thing. It appeared that your body got used to the prednisone, or your what do you call it?
Your adrenals?
The adrenal glands just stop producing cortisol, so you just need to supplement prednisone for a long time. They didn't really give me a timeline.
Yeah. Oh man. So we don't know why you're stuck on prednisone, whether it's the disease or damage to your adrenal glands causing secondary insufficiency to your adrenals. But whatever it is, you've been on it. You have a long experience taking it. So we've heard how you started, but I promised everyone that we would hear something exciting, a side effect story that isn't typical, that people don't talk about enough. And I would love to hear your story.
Yeah, so what happened is when I got pregnant in 2018, with rheumatoid arthritis, and of course, the physician wanted to be very safe in terms of medications, right? And want to hurt the baby, but the one medication that they said it was going to be safe during pregnancy was prednisone. So at that point, I was actually on a pretty low dose, between 4 and 5 milligrams a day. But during pregnancy, they say, no, we're gonna increase it to 10 milligrams. And because we're stopping all your pain medications, everything. So It was horrible, horrible, horrible pain. And the only thing that helped with my pain again was prednisone, because that was the only thing that they were able to adjust. So life continued. I was 20 weeks pregnant, and one lady ran the red light and T-bone us.
Oh no.
So so that led me to a huge rheumatoid arthritis flare up. And so what happened? They increased my prednisone to 20 milligrams until the rest of the pregnancy. And I said, you're going to continue that until you deliver your baby. And I did have a specialist that it was looking after me, like the inflammation levels. But the only thing that was able to control the pain at that time was the prednisone. So I said, I'll take it, right? That was the only thing that I was safe. So the moment the rheumatologist told me, generally for women with rheumatoid arthritis, they hit a postpartum flare-up at 6 to 8 weeks after delivering a baby. Well, I went through a C-section and I had the flare-up the next day.
Can't believe that. Like the next day. Oh, that's horrid.
And I believe, and I don't think they've received the prescription from the specialist, but I believe I was supposed to get up to like 80 milligrams or 100 milligrams of prednisone IV during the delivery of my baby and a few days after. To be honest, I'm not sure if that happened, but all I know is that I kept complaining. I said, the pain is unbearable. And they said, oh, but it might be the incision from the C-section. I said, the C-section is a paper cut. Like, forget about the C-section. What's killing me is the pain, the flare up, the RA pain. I couldn't lift my baby. He was only 4.5 pounds.
Oh my gosh.
And he weighed like he was an elephant. I couldn't breastfeed. It was so painful and frustrating. So nobody listened to me. I would say is the rheumatoid arthritis, is not a C-section. So I self-medicated. I know that was wrong, but I kept asking for help. So I started increasing the prednisone to 10 milligrams, 15 milligrams sometimes, because that was the only thing that was taking the pain away. Until slowly I started having some edema. My legs look huge. I couldn't breathe. I was kind of choking. I felt like there was like fluid in my lungs, and they kept telling me that it was normal from the C-section. And I did not really tell that I was using the prednisone, but finally I said, seriously, I'm in pain. And I've been taking this prednisone for the past week. And they said, well, you develop congestive heart failure. All because a combination of the rheumatoid arthritis flare up and also the prednisone. And I was like, are you kidding me? So because in my mind, the whole time for almost 15 years, the rheumatologist told me, when you're having a flare-up, you could increase your prednisone by 1-2 milligrams and then bring it down.
Yeah.
And this time I was so desperate that it was too much. Even for me, like 10 milligrams, I was on it before. But perhaps because of the fluid shifting and everything that was happening in my body, that just pushed me to the edge, and I had to be re-hospitalized to flush all the fluid out and control and treat the CHF.
Oh my goodness. Okay, so CHF, for those of you who don't know, used to be called like congestive heart failure. It's also been called chronic heart failure. Now it has some fancy new terms like heart failure of the right with the ejection fraction preserved or not preserved. Anyway, it has lots of different names it's gone through over time. But essentially, it is when the heart isn't pumping right and it's kind of lagging. And so the blood isn't flowing right, and it's like stuck in the lungs and just pools in your feet kind of thing. Mm-hmm. Normally, this doesn't happen to a young mom. This is normally something that happens in like your 80s or 90s. It's kind of, if nothing else has taken you, your heart just kind of over time starts giving up. And this is one of the ways. It's not something a young mom is supposed to have to deal with. So normally it's also a like chronic thing that once the damage is done, it's there and like there's no going back. So is it really still there for you? Like, is it still a chronic thing that you're dealing with every day, or did it kind of get better?
No, it got better. I was monitored for a year, and then the cardiologist cleared me and I said, "You're fine. You go back to your normal routine and get back." Still haven't been able to come off of it. Last year again, it was a pretty awful year for my rheumatoid arthritis. The treatment I had to change. So sometimes when they're changing or trying a new therapy, they pump up the prednisone again while the other medication kicks in. So it's been my life companion, seriously, for 20 years. And people ask me like, "Oh, have you gained weight from it?" And I haven't.
Even when you were on higher doses?
No, I haven't. I probably got the
Oh.
puffy face. It's already puffy, like it's naturally puffy. But no, weight gain has not been. On the contrary, it has been more like loss of appetite. When I'm on prednisone, I feel the loss of muscle mass, like my muscles get weaker, and I don't sleep, like I can't sleep, and I get angry at everyone. So I tell them, I'm pumping up this prednisone, so please forgive me if I said anything inappropriate, because I'm like, I'm a
It's a
horrible
side
person.
effect. It's not me.
It's just like I'm a horrible person. It's like everything makes me snappy. It's so that's probably I'm a jolly person. So when I get that prednisone, I don't know, bitterness, it bothers me. And the sleep disorders. That's really the things that I struggle with the most when I spike the prednisone.
That's interesting to hear. Going back to the weight gain, like 70% of people on prednisone report it. So you're one of the lucky 30% who doesn't get it. That's great. But you're getting the miserable, snappy bitterness and sleep deprivation. I got those too. So I definitely understand how miserable that can be and how it's like a vicious cycle, right? Like, was it the sleep loss that's causing the emotional roller coaster, or is it the emotional roller coaster causing a loss of sleep because of the prednisone and yeah, spiraling down? It's
It's
so
so
hard.
true. So true. It's the thing that the sleep disorder just kicks me in right away. So right now I'm on 3 milligrams and I've never been that low in my life. So I'm very lucky. I'm very happy actually
Yeah.
that it's down to 3 milligrams, and I'm in the process of consulting with my rheumatologist. Could I continue working towards, getting rid of it completely? Or like you mentioned earlier, do I have an adrenal deficiency that I might need to supplement for the rest of my life? I don't know.
Yeah. And you can't really know until you try going off of it. And it's so hard. That's a whole nother conversation. One more thing, I wanted to go back to your heart. So most people don't know that prednisone affects your heart, that it can cause like long-term damage. And I really appreciate you sharing the story because it shows that it can cause a short-term episode of your heart having issues, but then it can also cause long-term issues. And so you've gotten the clearance from your cardiologist. Have you had any other like weird heartbeats or high blood pressure or anything else like that ever since?
No, actually, recently, probably a month ago, I did have some chest pain. So whenever I go back to that hospital, that when I was hospitalized, they do take me in, and they're very serious. I say you have an autoimmune condition, inflammatory. So the doctor was very careful, and he did an ultrasound, an X-ray. Like he did all the tests and said, no, your heart is fine. It's not inflamed. It's doing okay. So there's no, thank God, it's my heart is still pumping. Okay.
Still ticking. That's good. That is
Um,
good.
but it's still in the back of my mind to see that it is possible. It was very scary. It was so scary.
Yeah. So you've taken it for rheumatoid arthritis. Is there any other autoimmune or other condition that you've needed to take prednisone for?
Well, I'm not particularly sure. I also have Sjogren's syndrome, which is another autoimmune disease or rheumatic disease, and a fibromyalgia, but I'm sure that mostly the prednisone has been prescribed for the rheumatoid arthritis. And there has been like several stages in my life where they increase it, but always for certain, every time there's a change on the main treatment, the prednisone goes on.
Yeah.
It's just the necessary evil.
Yeah, exactly. It is. Yeah, I haven't heard of anybody using prednisone for Sjogren's syndrome. I've heard of like Restasis, the eye drops, the cyclosporin eye drops. That lots of people take cyclosporin and prednisone because it's an anti-inflammatory thing people often use for autoimmune conditions, but it's an eye drop instead of the pill that a lot of people end up taking. So have you ever used that eye drop?
Yes, oh, definitely. My Sjogren's again, just like I just go for the extremes. I had this severe Sjogren's, so I have like no tears at all. So very poor, like saliva production. Like have my Sjogren's for even before the rheumatoid arthritis. But definitely, it's like with the prednisone with the rheumatoid arthritis, it was so visible. Like when I took it initially, and my joints actually, I could see the swelling going down. Like as you can see, my arthritis was it's just the deformities, and they're irreversible. So this, like even as a dietitian, I always say like medication are so important in the treatment of these autoimmune diseases. Food will never ever replace the treatment. So the early detection and early treatment will prevent this.
Yes. Oh, I love that perspective. Okay, we haven't even talked about this whole part of you. So let's talk about it. You're a dietitian. How do you help people? What have you learned? What can you share about this?
I learned I actually like to it's something very clear for patients. It's that I've been living with rheumatoid arthritis for over 20 years. And diet is not a cure and it's not a replacement of the treatment. And I think I want to make that very clear. Diet and even food in this situation is not medicine. I'm sorry. But you actually need the actual medicine to get treated and to prevent these joint deformities. Because my a healthy lifestyle in Colombia, I was studying nutrition. That still didn't prevent me from getting joint deformities. What it helped was getting the treatment, getting them to more advanced therapies, which luckily a lot of people have access to. It doesn't take away that rheumatoid arthritis is still the fatigue. You still kind of continue with that. Sometimes the treatments start fail, and it's that the treatment fails. You don't fail, it's the treatment.
Yes, it's not you, it's the treatment. I love how you're taking away how we take upon us this guilt, and it's not our fault if the medication isn't designed for us. It might be other people with our disease, but not for us. So yeah, keep going.
So you have to take that honest. Like it's not your fault. Would it be your fault if you start seeking treatment and you still trying to replace that treatment with crazy diets or restrictions? Then that would be your fault. Because you're taking those measures. So that's why you have to take a very like holistic and comprehensive approach to managing autoimmune diseases and rheumatic diseases. But I do find though is that when it comes to taking the right nutritional strategies, it's like a healthful lifestyle in general, it will help prevent other chronic illnesses, right? So it could help you manage certain side effects, and a lot of them could be related to prednisone. So when I speak to my patients or when I consult my patients and they are on prednisone, One, I acknowledge their fear and how they feel about taking prednisone. Acknowledge that, yeah, there's a fear that could be that weight gain, that there is a fear that they could retain fluids, that they feel. So there's actually dietary interventions you could do. You need to control your sodium intake. I actually had a patient who was drinking like over 4 liters of water.
So you had something to show me. I want to see.
Yeah, so what I wanted to show you, so when it comes to nutritional interventions, when you are taking prednisone, so there are actually a few tips that you can consider. So first of all is you want to increase your protein intake. Mainly, or I suggest, especially for reducing inflammation, more plant-based sources. So think about legumes, seeds, and nuts. Particularly, remember that when you're on prednisone, you are at a higher risk of losing more protein, right? Your kidneys. And also, you want to make sure that you want to keep those muscles strong. Keep your sodium intake low. So I know, and this is a hard one because I find that a lot of patients with prednisone, they get those munchies and all they want to eat are the salty snacks, right?
Exactly. It makes you crave it. It's so bad, but it's like the worst thing you can do.
It's like oh my goodness. But I always think, okay, just honestly, don't deprive yourself, because the more you look at those, that popcorn or those chips, just make sure that you portion those, enjoy them, savor them. It doesn't need to be like a lot of them, but at least portion them. Don't take them out of the bag, straight out of the bag. Just put them in a bowl, enjoy. It's still away from the kitchen. And perhaps just after 15-20 minutes, just taking your chips and enjoying them, you probably won't need them anymore.
That is a great tactic. I love that. Just giving us a tool that we can use to not succumb to eating an entire bag of chips.
Yeah, and it's still enjoy, because the more you say this, you tell yourself, I can't have it, you just want to have them, right? So once you allow yourself, when they give permission to yourself, it's like, oh, I don't need to eat the whole thing. This is okay for me. So that has been working with my clients. Monitoring your fluids, I had very active clients, and while doing so, they were overhydrating themselves. They were drinking 4 or 5 liters a day of fluids.
Really?
Not just water. So they were saying, like, I'm still gaining weight, but I'm not eating anything extra. And I said, well, I want you to monitor how much fluids you're actually taking, and see if, like, was it normal for your physical activity? Based on your activity, perhaps you need 2 liters of water. That's fine. It keeps you regular. But what about if you're consuming more than that? And I had a client that specifically was drinking so much water and started decreasing slowly, and her weight is starting to come off.
She was retaining water. Yeah, prednisone definitely does that.
So I was like, monitor, and also eating a calcium-rich food. So remember, right, that prednisone loves to, I was just like scrape, right, the calcium of your bones.
Yeah.
Also, like, making sure you have like your vitamin D. So calcium-rich foods. Fortunately, if you're following a plant-based diet, remember now most of plant-based beverages, almond milk or soy milk, they're all fortified with calcium. Orange juice is fortified with calcium. Dairy products, of course, they're like filled with calcium. Tofu, it's actually very rich in calcium. Canned salmons and sardines, those are the ones that I said are the richest. You could get maybe from other vegetables, but these ones, in fact, are going to get absorbed in your body. And also, in order to balance the sodium and potassium intake, the sodium levels, you want to increase the potassium-rich foods, right? So beans and lentils, as you can see, I love my beans and lentils, and anything legumes, like avocados, bananas, prunes, tomatoes, oranges, potatoes, dairy products. They're all are high in potassium. So it's all, like, I think the pearls when you are on prednisone to keep up with the protein, the sodium, potassium intake, monitor your fluid intake, and eat your calcium-rich foods. And don't forget to supplement with vitamin D. At least I think those are the ones.
I love that. Yeah, when you're in where you live in Canada, it's pretty hard to get vitamin D from the sun, right?
Yeah, absolutely. But even for those who live anywhere else and they have access to the beautiful sunshine, they have seen that patients with autoimmune diseases, they tend to have a lower vitamin D levels. So it's worth like get them checked just to see if you need like supplementation, even if you're living in these sunshine countries or counties.
Yes, exactly. I couldn't agree more with pretty much everything you've said. This has been so valuable. So, I mean, I was gonna ask what tips you have, but like you just nailed it. We're set when it comes to that. And then let's see. I think we've talked about alternative medications. So I wanted to know, we have just a few more questions, is what would you tell others with prednisone to expect when taking prednisone?
What to expect? Oh, what to expect in terms of side effects?
Just like what you wish you'd known, or that first dose, what maybe going from before to after, what to expect, the good, the bad, the ugly.
The first dose is probably the most wonderful dose that you ever, if you're taking it for pain, honestly, it's probably the most pleasant that you actually feel like, oh my God, I could stay on this medication forever. It's like bliss. Honestly, I'm not kidding.
Yeah.
It's if you're being suffering in pain, especially if you have arthritis or inflammation, and you just take honestly that pill, it feels like it's like a magic pill. You take it and it takes that pain away. It's wonderful. But it's too good to be true. And yes, it helps. And even in the rheumatology field, as they were aiming to reduce and to use prednisone only temporarily because of all the side effects or systemic side effects that we discussed today. So definitely you could expect if you're higher doses to have some weight gain. So I said it is possible. Sleep disorders. I had mood disorders. I got very moody. One thing that I forgot, I bruise easily.
Oh, yes.
Bruise easily. My husband thinks like, oh my God, you might think that I beat you up. And I said, no. No. And it's like, I don't like cover up your arms. And it's like anywhere, I don't even know. And I have a bruise. So that's really unpleasant and unexpected from prednisone. You could have increase in appetite. Some others might have a loss of appetite. That's my case. But I think the increased appetite is more common. That's what I feel like I experienced. Mouth sores. And okay, yeah, I have another one. Yeast infections.
You've had those.
I had those yeast infections. Whenever I take the prednisone, eat them both orally and vagina.
Yeah.
So those I seem to every time when I have a higher dose of prednisone and mouth sores. So it's probably related to the immunosuppressant effect of the prednisone.
Yeah. It's funny because I heard about that side effect in pharmacy school all the time. And I have talked to very few people who've actually mentioned it. So I'm thrilled to actually hear that side effect mentioned, because you're right. It does decrease the immune response that would keep the normal yeast in check. Like the yeast is there. It's in your mouth. It's covering your whole body, your vaginal area and everything. But normally your immune system can keep it just in the right balance. But then the higher the dose, the more likely you are to have that. And often people with the inhaled version of steroids, they have to deal with that because they're actually putting the steroid right on their mouth, in and around their mouth. So
Exactly.
yeah, that's a one you don't hear very much, but it's unappreciated because it's so painful, right? Like those sores in your mouth.
It is uncomfortable because it's the treatment is quite awful when it comes to when you have the oral thrush. And also when you have like vaginal like yeast infections, it also, can affect your sex life, right? Intimacy, it's uncomfortable, it's painful. And again, like women are so like we're not so open to talk about it, but it is a reality.
Yeah.
Another unpleasant side effect, and I actually had this in my 20s, it was osteopenia.
Yes. Yeah, the bone loss. Yeah. But when we first started this interview, you were doing something. You were like, I just got back from the.
Oh yeah, I got back from the gym.
And so I'd love to know, what do you do at the gym as somebody who clearly has, an impairment in functioning like a normal person would at the gym, but you're aware of how vitally important it is to prevent further bone loss, right? So what do you do at the gym?
So at the gym, I typically do around like 20 minutes of cardio. So depending on how my levels of pain. So biking is usually safer and the elliptical machine. If I'm okay, I will do the treadmill, maybe 15-minute walk, because that could also have like a high impact exercise on my knees. So I'll say the bike or the elliptical will be the safest. And I'm very lucky that at these, I go to the city of Oshawa here in Ontario, and their facilities, they have a personal trainers, and they're not out there to get you. They actually support you. And I am there. And I said, today I want to work on my biceps. So I always add some strengthening exercise because I know that's what is going to make a difference in terms of bone density. So I'm very conscious of always exercising at least one part of my body, making sure that the moment I started feeling pain, there's that pain that it comes with the exercise, but there's that pain that is related to arthritis. At that moment, I stop. So then the next day, I won't feel like, oh no, I'm so sore, I can't go back to the gym. So it's becoming like a vital part of my routine. And it's definitely helping me with the fatigue. I don't know what it is, but if it's helping me with reducing the prednisone because I don't feel that inflammation. So it has all these benefits that I'm just in awe. So, but always most importantly is to listen to your body and to move. If you can't go to the gym, at least go for a walk, or go outside and get some fresh air, stretch. But movement is so critical.
So critical, because you've talked about bone loss, and earlier you mentioned the muscle loss, like you felt it happening. And what you're doing, that strength training, is one of the few things that you can do to help counteract that, because it's like once it's gone, it's really hard to get back. So doing what you can to maintain it.
It's so true. It's so easy, as in I've been a patient for so many years, and I have gone through the dark holes where it hits me, the pain, even with the prednisone fatigue. It's like, I'm not moving. I'm not getting out of here. But that is really not helpful. And so the more you can tell yourself, the more I move, let's get up, even if it's just the one thing, 5 minutes you can do for yourself, and you're gonna feel so much better. And I'm saying it from experience. It's from a very young age. And a physical activity has always been part of my life. And my mom in Colombia. And so much so that I got so excited that I might teach some Zumba Gold to the seniors in my city.
Wow, Zumba. That's awesome. I love Zumba. It's so fun. That's awesome that that's part of your heritage and your families. You're generationally active. That's fantastic.
Yeah, we have to, honestly, the one thing is keep on moving. I remember my dad, when I was with rheumatoid arthritis, I was just active, and I was just lying down for hours at a time. And they had no idea, no medical said, Cristina, move, let's get moving, let's go for a walk. I said, no, I don't want, let's go moving. You don't use it, you lose it. So, yep, he was right.
Yeah, you don't use it, you lose it. Exactly. Okay, so you mentioned your name, and I have to know, have you watched Princess Bride, the movie?
Of course.
Because your cousin's in it, right?
I never heard of it, to be honest, when I came to Canada and I said, oh, my name is Montoya. He said, why are you talking about?
Yep. Your name is just so perfect when it comes to, my name is Inigo Montoya. Yours is like the exact same syllables, and like the E sound is even in the middle.
Yeah.
Cristina Montoya. You killed my father, prepare to die. Because I have used that exact story of him, of his experience as the swordsman. His dad made swords, and the six-fingered man came and wanted a sword built just for his special hand. And then when he came, he refused to pay, right? So the six-fingered man killed his father. And then when he tried to defend the honor of his father, he gave him scars on both of his cheeks. And I've loved that because he used that experience, getting scars, losing so much, as kind of an analogy for our health, for like, we have to deal with something on our face that isn't what we want it to be. For most of us on prednisone, we get moon face at higher doses. And he didn't go and hide. Well, for a little bit, he did go and hide, but he used his facial change as a symbol, a daily reminder that he's a warrior and he has a fight to win. And you've given us so many tools, so many tips that we can use to counteract side effects and to feel so much better. So I want to know, finally, as a dietitian, what is your go-to snack when you're getting the prednisone munchies?
My go-to snack is definitely hummus.
Hummus?
Hummus with some gluten-free pita bread or guacamole with nachos, obviously, and beans. That's definitely my snack. And yeah, that's my go-to snack. I sometimes love popcorn. I don't deny it, popcorn. And as you can see, it's usually a salty snack. So I want to make sure that I pair my hummus with lots of veggies.
Yes, I love that. Yours is a salty snack. So funny when I ask this question, some people are like straight up like candy, other people are straight up fruit, and other people are straight up something salty. And so that's awesome. That was your like super healthy, yet it's got a little bit of sodium, more than normal, but still delicious and good for your body. So
yeah, absolutely. So, oh my goodness, this conversation was amazing.
Yes, I really appreciate your time today. Thank you for joining me and all the other prednisone warriors. I'm Dr. Megan, your prednisone pharmacist, and we're signing off. Thanks, Cristina.
Bye-bye. You're welcome.